Morning, everyone. I just wanted to take a few minutes to stop in and talk to you guys about something that you're going to be reading about today, and that is pathology clinical consultations. Okay, and the reason I wanted to talk to you guys about these is because the coding for it is just a little bit different than what we're accustomed to. Some of the codes for these are almost like E&M codes where they get coded based on medical decision making or the time spent that was spent by the clinical pathologist in order to do the consult. Okay. So what a clinical pathologist is someone who interprets and all the pathology and laboratory testing that we studied last chapter, or we're studying this chapter, excuse me. The clinical pathologist is the person that interprets and reads those tests and tells the doctors what they mean. So when a doctor orders a barrage of tests for a patient, they will get a clinical pathologist to consult on those results and give their advice or opinions. Okay. And the code range for these consultations are 80503 through 80506. Okay. And the way they decide which code they need, they're either going to base that on medical decision making, which that breaks down into how complicated the case is, the tests were, whether they were, and those of you guys who have been through E&M codes, this will sound familiar. If you haven't yet, this will sound familiar in the future. Okay, medical decision making is either going to be straightforward, moderate, or high. Excuse me, straightforward, moderate, or high, and those are the three levels that determine how the higher the level, the higher the complication of the testing and the reports to be interpreted. Okay, and the other way they can do that is they can determine it by time, the time they spent going over the test and results and things like that. Okay, and in your book on page 647 is where you'll read about this, and it states that for use of code 80503 would be 5 to 20 minutes. Okay, 80504 would be 21 to 40 minutes, and then 80505 would be 41 to 60 minutes. All right, and if they send, and it states in the next sentence that if they spend over 60 minutes on this consult, they are to code 80505 and 80506 to indicate that there was extra time spent. You use the maximum amount time spent plus the add-on code to let them know that there was more than 1 hour. Okay, so that is just something that I wanted to point out to you guys. So it's something that y'all would pay attention to. It is something important because, again, it is a little bit different than the other code, the procedure codes. Okay, and also I want to mention that these codes, these 8,000 level codes, are not in the E&M section. There are other consults that are mentioned in E&M, but these clinical pathology consults are not in there. They are in the pathology section of your CPT manual. So I hope this helps to clarify what you're reading to you guys. And if y'all have any questions, by all means, please get with me and let me know. And I hope you guys have a great day. Thanks.